Hi everybody, this is Dr. Deb from Serenity Healthcare Center, and today I'm here to talk to you about erectile dysfunction and sex. So what if I told you that you could potentially have a heart attack from having sex? Would you take the risk? Well, if you were my husband, he'd say absolutely, that's the best way to go out of this world with a smile on my face. In all seriousness though, there are risks to using erectile dysfunction medications. There's permanent blindness, hearing loss, and yes, heart attack. And with 52% of the men in this country between the ages of 40 and 70 having some form of erectile dysfunction, this makes Viagra and Cialis one of the most popular written drugs for prescriptions today on the market. Roughly 62 million prescriptions are written annually for erectile dysfunction medications. And they don't tell you that they're contraindicated when you use antibiotics or anti-seizure medications or high blood pressure medication. And most of the time we see erectile dysfunction occurring when there's some form of hypertension that's involved there. So we need to have a serious conversation about how safe these meds are. So not only are we risking side effects in our health, there's also a huge cost that goes along with these medications. With roughly each pill costing $65 for one pill, meaning with Viagra you have a lasting half-life of about 12 hours and Cialis maybe about 72 hours, that makes it a very expensive product on the market to use. And because of this pushes a lot of people into the counterfeit market for drugs. They get their medications then from Canada, or they buy straight from the black market because it's cheaper. And did you know that roughly 37% of the drugs seized on the market today are of Viagra and Cialis? That's a huge amount of people that are taking a medication that is not even the drug that they think it is, and it can cause a lot of problems. Well, I'm here to tell you today about an awesome peptide that I learned about called PT141. Now this is a peptide, which basically means it's an amino acid. So it's very natural. It's something that we would find in our food source or something that we would find in our bodies anyway as an amino acid. But we were able to extract out this amino acid and change it a little bit molecularly to get it to function as a peptide, which is super exciting today. So PT141 is used for erectile dysfunction, also used to increase sexual function as well. At a fraction of the cost of Cialis, roughly costing you $25, $30 maybe max per dosage, and this dose lasts 72 hours, can make a big difference in everybody's pocketbook, as well as make a huge difference in your sex life. So the bonus to PT141 is it not only helps increase stamina, duration, and erectile function, it also helps promote fat loss. So along with having a great sex life, you can slim down at the same time potentially. So if you're interested in learning more about this PT141, I would urge you to call Serenity today and let's have an open conversation about sex and what your options are for safe and effective use. Thanks, guys.